Good morning, everybody. I see we have quite a good crowd of participants that numbers are still building up, but I think we should get started because we have a pretty tight program. Welcome, greetings from the University of Calgary. My name is Andy Bullock. I'm a psychiatric epidemiologist, professor in community health sciences, and a founding member of the Matheson Center for Mental Health Research and Education. On behalf of the O'Brien Institute of Public Health and the Matheson Center, it is my pleasure to welcome you to this town hall organized by a research team led by Dr. Jacqueline Smith, who is a member of the Matheson Center and a researcher in the Faculty of Nursing. The O'Brien Institute and the Matheson Center are delighted to partner on this event. I would like to take this opportunity to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, which includes the Chiniki, Bears Paw, and Wesley First Nations. The city of Calgary is also home to the Métis Nation of Alberta, Region 3. The legalization of cannabis has offered an opportunity for extensive research and education in many aspects, including harm reduction. The University of Calgary boasts world-class researchers looking into various aspects of cannabis, from basic science through clinical to population mental health perspectives. In today's town hall, you'll be hearing about the Cannabis Café, a harm reduction initiative led by Dr. Smith and her team. That will take place for the first hour. And then there'll be a 30-minute panel discussion examining cannabis research from a broad perspective. I'm looking forward to an informative event and hope you'll find it useful for your research and practice. I hand you over to Jacqueline and her team.
Thank you very much, Dr. Bullock, and I would like to welcome everyone to the Cannabis Café Town Hall. Just a couple of housekeeping things at the beginning. One is that this webinar is being recorded, and if you look at the bottom of the screen, you'll see that there's a chat feature, Q&A, and a couple of others as well, but chat feature will be disabled for this town hall, but please, I would invite you to put your questions in the Q&A section. We'll be covering questions specifically to the Cannabis Café at around 11:18. And then, like Dr. Bullock said, there'll also be a panel discussion at the end at 11:30, and you can also have your questions for that. So like Dr. Bullock said, we have a full agenda for today, so let's just jump right into it. So again, my name is Jacqueline Smith. I'm an assistant professor in the Faculty of Nursing and also the Director of Mental Health and Wellness at the University of Calgary in the Faculty of Nursing. And I'm the principal investigator of the Cannabis Café and the associated research. You'll notice I have a little bit of an upward gaze because I'm using a screen right up above. So I would first like to thank everyone for taking the time to just to be here today. Know how busy, maybe zoomed out you may be, but obviously we've had over 200 people register for this town hall. So we recognize that this is, there's a lot of interest in this topic, so we welcome you. I would also like to take a few minutes to acknowledge my research team and my esteemed colleagues whose contributions have made this project a huge success and who will be joining me in the presentation of the Cannabis Café. So first off, we have Dr. Ken Winters. He PhD. He is a senior scientist at the Oregon Research Institute, Minnesota location, and also an adjunct faculty member in the Department of Psychology at the University of Minnesota. Also have Joel Mader, my former research associate in the Faculty of Nursing. Joel was at the beginning of this project and he played a key role in the development of the Cannabis Café and the Facilitator's Guide. So we're really excited to have him present after on the actual Cannabis Café. And last but not least is Jennifer Smith, my current research associate in the Faculty of Nursing. Jen has been involved in the Health Canada grant from the beginning, and in the evaluation of the Cannabis Café, and in this town hall as well. So next slide, please, Jen. So I would like to first acknowledge the kind sponsorship of the Matheson Center, of the O'Brien Institute as well, and of course the Faculty of Nursing. We appreciate their just their support of this whole project, and their expertise in this field as well. So we take their lead as we move forward in our projects. So next slide. So to begin, you know, there's a research story behind the beginnings of the Cannabis Cafe. So Dr. Ken Winters and myself would like to provide a little bit of the context for this event. Go ahead, Jen. So, so before my start at the University of Calgary in 2017, I was a part of a team of researchers, including Dr. Ken Winters, who were exploring adolescent substance use disorders and family treatment approaches. So as a broadly published researcher and author pertaining to cannabis and many other subjects, I knew that Dr. Ken Winters was very interested in Canada's very bold move to legalize marijuana. So in the fall of 2017, I was awarded an interdisciplinary grant through the Faculty of Nursing to bring in international visiting scholars to help support my new and evolving program of research. So I chose Dr. Ken Winters and Dr. Amelia Area. And I felt that with Dr. Winters and Area's experience and mentorship, they could support my area of research where I was looking to explore the experience of cannabis use among university students pre and post legalization. So in addition to bringing Ken and Amelia in to help support that, I also asked them to provide some research training to my growing research team at that time. And they kindly did that. They also did presentations for the Matheson Center, for the University of Calgary. They filled their role very nicely as visiting scholars. And so because we were looking at this exploration, we felt that we really needed to get the university's support. So we went to Dr. Drew Marshall to introduce our research and to ask for her support. And she was just incredibly supportive and really saw this project as a valuable tool to capture the students' experience and their voice, and to use as data to help inform the policies and procedures that they were working on at that time, pre-legalization, on our campus. So I just want to turn the time over to Ken now, just to speak, I think coming from the American perspective and his experience, just to talk a little bit about this project and his willingness to come and support it. Go ahead, Ken.
And thank you, Jacqueline. I appreciate the opportunity. Hello, everyone. This is an outstanding event and very timely. You're going to hear a lot about cannabis research, but also about an important program. The thing I want to emphasize is that focusing on young adults and cannabis use makes a lot of public health sense. For those that have done surveys of various age groups, whether they are national or local surveys, whether they are in the United States or Canada, it appears that there's one converging piece of evidence, and that is that the young adult age group is the group at which reports the highest prevalence of cannabis use, higher rates than teenagers and higher rates than those that have moved past their young adult years. So the college population is very relevant to be talking about this, looking at it from a public health perspective, thinking about prevention programs and harm reduction programs, and making sure that something that is legalized, but also is a product that's has with it appropriate information. So users can be informed whether using it for medicinal or recreational purposes. One other point is the value of Jacqueline's foresight to do a survey before legalization, so that there's many advantages then of looking at how things might have changed when there's the opportunity for a survey post legalization. You'll be seeing some of the pre-legalization data soon. Thank you.
Thanks very much, Ken. So Jen, if you want to, okay, here. So this is where it all started. So in March 2018, so remember October 2018 was the legalization. So in March 2018, my research team launched a survey to explore our university students' experience with cannabis. So again, 6 months prior to legalization. A random sample of 4,000 university students were asked to complete a cross-sectional web-based survey, and we were pleasantly surprised with a 55% response rate, which told us that our students were very interested in the topic and were invested in having their voice heard. So just over half of those students, so about 1,200, reported using cannabis at least once in their lifetime, and 48% reported never using cannabis. So of those who reported using cannabis, again, the 1,200, 11% said that they were also using cannabis for medicinal reasons. And of those who were using medicinally, 86% were also using recreationally. So, but of great interest to us was that 60% of the students requested additional cannabis education. So again, Ken, can you talk about the significance of that? I mean, one, the response rate, and what the students were saying to us about wanting more education.
Well, it's a great sign. Students wanting more information. Perhaps it speaks well to how we try to impress our citizens of all ages about public health topics. Lessons learned from tobacco use, alcohol use have, I think, informed and impressed many people that users of legal products do want to be informed about its proper use. It is interesting that there's a fair number of medicinal users, and we'll get into this in a little bit, because that probably is still I'll call it a learning curve for Canada as well as the United States, where we have about 30 states now in the United States that have approved medicinal use. Is it effective? What should it be used for? Should someone be using a THC-based product, a CBD-based product, or both? Those are still difficult questions to answer for specific individuals who are addressing specific ailments or disorders. Some say that we perhaps have moved the medicinal legalization ahead of where the knowledge base is, because the evidence of how well it treats various ailments and disorders is still an open question. More on that later. Thank you.
Thanks, Ken. Jen, next slide, please. So, as a researcher and a registered nurse, several of the findings were significant to me. So of those 1 in 10 students who reported using cannabis for medicinal reasons, most were using it to manage mental health conditions, as you can see in the graph. So we have anxiety, OCD, PTSD, sleep disorders, and depression. And of those, 13% of the students who were using medicinally also met criteria for a cannabis use disorder. And that was based on an 8-item self-report cannabis misuse screening tool called the CUDIT, where scores greater than 12 are indicative of a cannabis use disorder. So Ken, can you speak to the significance of this? And you opened up that door, but of the medicinal use again amongst these young people, and specifically using for mental health disorders.
Well, I don't think it's a surprise that people are drifting towards marijuana use, particularly THC-based, to help with negative emotions, angst, anxiety, depression, etc. Because when you ask people the benefits of using, you usually get positive emotional and social benefits. But if you put a rigorous spotlight on do these disorders benefit from use of THC and or CBD based medicines, you come away with actually fairly negative results. So there's several reports. Canada, I know, has reviewed it. The Canadian Family Physicians Report. Then there was the National Academies in the United States. There also was a recent publication by Black and colleagues that's more recent, 2019 publication. And the bottom line is there's scarce evidence that you're getting effective treatment for mental or behavioral disorders. The mystery of pain and marijuana is still also an open question. So, one cautionary note about all of this is people might be getting some temporary acute relief, but two things might be happening. One is they're not going to get long-term relief. And the other problem is they might be making their problems worse downstream. And these are the kinds of questions that are getting addressed by researchers, but they surely do pose a cautionary note when people are using marijuana for medicinal purposes.
Okay. Thanks very much, Ken. I have a feeling this is going to be an active discussion in our both Q&A and the panel discussion. So I welcome, again, your questions in the Q&A section so that we can address those. So, we've got 60% of our students saying they want more education regarding cannabis use. And so I want to tell you that a focal point of our beginning to think about how we're going to do this was this document. So it's Canada's Lower Risk Cannabis Use Guideline, and it's endorsed by multiple credible organizations, and it's a harm reduction tool. So I will be referencing this, but I did want to bring this up and acknowledge. Okay, next one, Jen. Okay, so as an example, we did a lot of, it was both mixed method. We had quant and qual questions, but one question in particular that we asked specifically around harm reduction is, if you smoke cannabis products, do you ever inhale deeply, hold your breath after inhaling, or plug your nose? So as you can see, many of the students were actually engaging in harmful smoking practices, including deep inhalation. And I'm guessing that when Joel talks about the education that we were providing to the students, some of them actually didn't even know that this was a harmful way to use cannabis. So again, really significant, and to the point where, Jen, next slide, the findings of our study informed two publications at the beginning. We have several more, but these are two that I want Ken to address. One was with the Canadian Journal of Psychiatry, and it's about, no surprise, cannabis use for medicinal purposes among Canadian university students. And the second one was addressing that point that was 11% of our students were meeting the criteria who were using for cannabis use disorders. So we have this second article on correlates of lifetime cannabis use and cannabis use severity in a Canadian university sample. So go ahead, Ken, if you want to speak briefly about these.
Thank you, Jacqueline. the first one on the left, you already have seen some slides in the last few minutes that provide a pretty good overview of that paper. Obviously, the paper can give you more details. I'd like to emphasize two things. One is, if you look at the various reasons for which young people are using cannabis for medicinal purposes, it doesn't match up well with, at this point, what the scientific literature says that would speak to the issue of are these ailments and disorders being effectively treated with cannabis. Cannabis is a complex plant. So in the future, it's going to be important to look at, is it the THC? Is it the CBD? As you may know, CBD or cannabidiol is not an intoxicant, but it is psychoactive and is believed to have some medicinal value? Or is it a combination of both that people are finding anecdotally of value? And of course, when things are being tested rigorously, how will that shake out? So stay tuned on that, because cannabis is a complex plant. And so when we talk about medicine, downstream, it'll be important to get more precise. The other paper that's highlighted on the right side of the screen looked at all of those in the sample that we've talked about and what predicted or what was associated with those that had lifetime cannabis use, as well as those that had used in the last 6 months, and then they were given a screening tool to see if they had so-called cannabis use problems or symptoms of a cannabis use disorder. Now, they all didn't have enough symptoms to meet a formal diagnosis of cannabis use disorder, but we just looked at people along a dimension of how many symptoms they reported. So there were several variables that were examined by Joel and Jacqueline and the team. Briefly, let me just read you some of the ones that are kind of interesting. If you know a lot about risk factors for substance use, the list I'm going to give you isn't too surprising, but there may be some still unique findings here. So there were two major dependent variables looked at: lifetime cannabis use. So that was one group. Remember, that was about 50% of the sample. And then there was a percent that met that had used in the past 6 months, not just lifetime, past 6 months, and then took the cannabis severity scale. So variables that were significantly associated with lifetime cannabis use when compared against non-users. Here was the variables: lower perceived risk associated with regular cannabis use, lower religiosity, lower rates of living with parents, greater support for legalization. They had a higher score on an alcohol use severity screen. They reported presence of history of mental illness in the family, and there was a greater preponderance of those that were varsity athletes that reported lifetime use. A different set of variables emerged when we looked at cannabis use severity. The significant ones were those that were the high end of cannabis use severity, reported earlier age of onset of cannabis use, being a male, reporting cannabis use motives related to social and mood benefits, reported lifetime use of medicinal purposes, and as Jackie noted, the issue of inhalation. They also reported greater use of the deep inhalation method, which can have public health consequences. So the variables related to lifetime use were a bit different than those related to severity of use. But from a public health perspective, as Joel noted in the paper in the conclusion, because there was a very strong relationship between those that met criteria for prior 6 months and had high scores on the cannabis use severity scale, there was a high proportion of them that said they were using for medicinal purposes. So that's an important group. It's a reasonable size group on your campus and likely among young adults. And so it surely merits, I think, some attention, particular attention for targeted prevention efforts.
Awesome. Thank you very much, Ken. We're just going to move along. I'm just looking at the time. So Jen, we could go to the next slide. I'm just going to briefly go through these because I know you're all interested in how we came about. So again, 60% of the students were asking for more. So what we did is we went back to the students and we asked them, so what's your perspective? How would you like us to introduce the topic? How would you like it to be presented? And just really wanted to get their perspective instead of assuming. And then we also pulled together a directors group. Dr. Andy Bullock was a part of that. We had the research team, campus mental health, the wellness team, harm reduction specialists, CAMH, Matheson Center, and Calgary Police Service. So it was really helpful to pull all that together. And once we did, next slide, Jen, we actually put together a World Cafe style of presentation of an event. We know that classroom delivery of education is not always as effective. We really wanted this to be interactive and intentional and evidence-based. And again, we used all the feedback from each of those groups. So in the midst of brainstorming all of this, lo and behold, Health Canada put out a call for a grant. And it was for substance use and addiction programs. And they were looking at psychoactive substances, including cannabis. So we're able to get a large sum grant. So we just moved ahead. Jen, next slide. We reached out to Dr. Darren Christensen from the University of Lethbridge, who well-versed in protocol papers. And we thought, okay, we want to put together a whole protocol paper so that we can actually measure the feasibility of this initiative. So that's what we did. Next slide, Jen. We then decided it was really hard to get our students who had competing responsibilities in so many different areas, even with pizza. So Joel actually had the brilliant idea of perhaps approaching the Faculty of Nursing and Social Work to see if they would be interested in having this as part of their curriculum. And they got approval, and it really was, like Ken has alluded to, a lot of public health issues within this. So we got the approval, we started delivering in the classroom. So next slide, Jen. So we did that pilot of 74 students, and the pilot actually helped us to enhance it. And surprisingly, students wanted it to be longer. They wanted more information, background information about cannabis and about stigma as well. So next slide, Jen. So what I did is I think this is really important. I went in 1 week before, shared the whole plan to deliver the Cannabis Cafe to everyone, and then invited them to be a part of a research project where they would actually evaluate the effectiveness of the cafe after. So everyone got it. And then we sent anonymous links, say, if you're interested in being a part of the evaluation of the cafe, please fill out the survey and get back to us. We provided incentives, 5 for baseline, 10 for immediately following, 1 month, 3 month. And we basically stayed in touch with those students and developed a whole evaluation tool. But this is all in the facilitator's guide, which I think many of you have already received. So I'm going to, without further ado, sorry, Joel, a little bit tight, send it over to you now to start talking about the delivery of the Cannabis Cafe.
Okay, thank you so much, Jacqueline. And again, welcome everyone, and thank you for attending. So I played a role in a couple of capacities, but the area that I'm going to focus on for the purposes of this morning is what I did in terms of facilitation alongside the research team. We also worked very closely, as Jacqueline noted earlier, with a harm reduction specialist from the Wellness Center named Alex Classon. So he was present to facilitate these cafes alongside myself. So we can go to the next slide, Jennifer. So the real aim of the cafe itself was to provide evidence-based cannabis-related information to students in a manner that really had folks engaged in discussion as opposed to a top-down approach. So we did that through Mentimeter, and I'll get into that in a moment. But the other core component was we wanted to promote and disseminate Canada's lower risk cannabis use guidelines, as Dr. Smith had noted earlier. We wanted to open up and see if we could address stigma. And then finally, we wanted to see if we could get folks to set some individual goals based off the information that we were reviewing as part of the Cannabis Café. Next slide. So as Jacqueline noted, I think really one of the most important strengths in terms of participation was moving towards a classroom-based delivery. So we did have some difficulties trying to get students to come after classroom hours to the Cannabis Café. And when we moved towards approaching the instructors and professors teaching relevant courses, we had a really very, very strong uptake. And in fact, I think we actually had more instructors and professors express interest in us coming to deliver the cafe than we actually had resources to do so. So that certainly was encouraging to us in terms of an overall approach. Next slide. So the first activity was trivia that we had facilitated via Mentimeter, and I suspect most folks have had some experience with Mentimeter or something similar to that, and essentially allowed individuals to be able to log in with their mobile or digital devices, and then they're able to respond to questions via those devices. And then it allows us to give a summary of the information that they're providing. So what we would do is we would ask them a question, we'd get their responses, we'd review the results overall as a group, and then we would also review some of the scientific information related to those items. And I have an example on the next slide. But before we go there, Jennifer, I'll just review maybe if we can go back. Wonderful, thank you. The other thing that we did was we also provided normative feedback via trivia. And so essentially what that is there's been a lot of research to show that post-secondary students tend to overestimate their peers' use. And there's some suggestion that perhaps adjusting or correcting those misestimations could result in some changes in terms of perceptions when it comes to cannabis. So we actually provided the feedback to the students from our UCalgary Campus Experience Survey. And we often found, as the research has shown, that the folks attending the cafe tended to overestimate the amount of cannabis use that was occurring on campus relative to our findings. I think the other really core component of the trivia, which we found to be really helpful, was it's very much based in discussion. So we're often asking the students questions, we're looking at the results and trying to highlight any consistencies with what the research is suggesting, as well as any discrepancies, and trying to get student involvement so that would kind of set the stage for the more personal experiences we'd be asking folks to share as part of the World Cafe. I think we're good to the next slide. Thanks, Jennifer. So this is one of the probably more interesting questions, and certainly in terms of discussion, that we found from the cafe. So we'd ask students, to your knowledge, what ailments is cannabis effective in treating and managing? And then we'd allow students to give up to 5 different conditions that they thought cannabis could treat. And this is a word cloud actually from, I think, about 130 or so participants of one of the cafes. And the larger words mean more folks endorse that specific response. And so we actually then contrasted this information with prescription practice guidelines that were outlined in 2018 for family physicians, and asked students, largely, why do you think there's some discrepancy between what we outline as being what we think to be effective versus what's being recommended in the literature? And some really interesting discussions came from this. One, some folks recommending perhaps that maybe this is because of some of the advertisement campaigns from dispensaries that were quite active before legalization, while others actually started to say, maybe we need to challenge how we look at the evidence that we're using to come to these conclusions around prescription guidelines. So certainly some very interesting responses from students in navigating this item. Next slide, Jennifer. Thank you. So the next really major activity, and I think probably the most engaging of all of them, was the World Cafe style. So one key thing that we did, so we'd have these large groups when we were presenting in the classroom, and then we'd actually, for the World Cafe, break folks into groups of about 8 to 10 in size. And we had student discussion leaders that were at each of the tables of these groups. So these were undergraduate students that were trained in advance to the cannabis cafes. And they were really the ones to keep the conversation going and really try to get the students in attendance to share openly. And we thought that that was an important approach, because we didn't, as researchers, and certainly, you know, to have a professor, say, for example, to be sitting at the table, we were worried that we might kind of intimidate or maybe shut down some of those conversations when it came to personal experience. And we felt like, certainly after having done a number of these, that that was a really helpful approach to have those peers present, as it seemed to facilitate a little bit more of a personal discussion. So the 2 rounds of the cafe, which is each round was about 10 to 15 minutes in length. One covered the cannabis use lower risk guidelines, and the second was asking students to raise any potential stereotypes towards folks that use cannabis, as well as to facilitate conversations between those that have used cannabis versus those who haven't. Next slide, Jennifer. So some of the principles of a World Cafe that we certainly made sure to embody in our work was to try to create a hospitable space where we invited students off the hop, and also gave them some food, and tried to just set the stage that this was a place that was a little bit more open for discussion versus maybe a more traditional classroom approach. We wanted to explore questions that mattered. So as Dr. Smith had noted, we did do a lot of stakeholder engagement, and we really made sure to include students on the questions that we were going to focus as part of the World Cafe to ensure that it was applicable to them and they thought that there was value in it. We made sure that everyone had an opportunity to contribute, and that was really the responsibility of the peer facilitators at each of the tables. Wanted to make sure that we were open to recognizing diverse perspectives. So we weren't coming at the cafe with a, you know, there's a right or wrong answer. We just really wanted to encourage that open engagement. And then finally, we wanted to ensure that we wanted to give folks the opportunity as a whole group to review some of the important themes that emerge as part of the World Cafe discussion. So we would actually, after each round of World Cafe, have our peer discussion leaders identify important themes that arose, and then we would actually review it as a full group. Next slide. So as Jacqueline also already noted, this is one of the guides that was really important and foundational to our work. And actually, this is a 2-sided document, and this is the first side, but there's also a second that provides a little bit more rationale as to why these 10 recommendations were put forward. And overall, actually, I think the students were quite receptive to this guideline. A lot of folks noted that there was some interesting items that they might be able to apply both to their personal use or to recommend to peers. We had a lot of folks that were in the midst of training to become clinicians, i.e., for example, nursing undergraduates or social work undergrads. And certainly some found that this was a document that they thought they could even bring forward in their own professional practice in the future. Of interest too, there was certainly some criticisms as well. And I think one that stood out was there was a sense that perhaps there wasn't enough balance placed on identifying some positives related to using a substance such as cannabis. And some folks have mentioned perhaps like focusing too much on the negative might not necessarily result in a balanced discussion. So those were some of the maybe larger themes that arose from our World Cafe related to that document. Next slide, Jennifer. Thank you. So We had a lot of challenge around the stigma piece in the beginning, because we found when we opened up just a general discussion of stereotypes, often we found that there wasn't always necessarily an in-depth discussion in our first cafe. So we tried to see if we could create an activity that would kind of prime folks as to some of the stereotypes that might exist with respects to folks that use cannabis. So this was presented to individuals at the cafe as a Mentimeter, and these are actually profiles of students from our UCalgary campus experience with cannabis. And we essentially asked folks to indicate which ones they felt like were most likely to have endorsed cannabis use before we went into the World Cafe discussion. And I think overall we found it to be effective in priming, because the truth of the matter is every single one of these profiles were individuals that had endorsed cannabis use. And so it helped us, I think, to get a little bit more in depth as to what beliefs translated into folks indicating that their response that they did. And I think overall we were pretty successful in starting to open up those conversations after our kind of a redevelopment or the couple iterations that we had gotten to. And this is certainly well presented in the guideline that we've developed. Next slide. So the final activity was really a SMART goal setting part of the cafe. And I imagine most folks have encountered SMART goals before, but they're specific, measurable, achievable, realistic, and time-based. And we essentially just asked students to take pieces of information that they found relevant to them and see if they could utilize it. So we had some interesting goals. Some, for example, folks that were individuals that were using cannabis indicated things like perhaps trying to use edibles as opposed to burnt cannabis products. Some folks indicating that they wouldn't use deep inhalation in the future. And then certainly for those that weren't endorsing cannabis use or recent cannabis use, indicated things like disseminating these guidelines to peers that they thought they could perhaps benefit from the information contained in the guidelines, which we also thought was a pretty interesting application of the SMART goal activity. Next slide. So this is essentially what's outlined in the guideline as a recommendation for folks that are interested in doing cannabis cafes in the future. And this was a kind of a general outline that we applied in the majority of our cafes. Next slide, Jennifer. Thanks. So the discussion leader training, I think we were actually certainly very successful in getting folks to sign up to be discussion leaders. And we had run a couple of different trainings, and I think the easiest format and probably the best format that we ended up settling on was to essentially do a mock cannabis cafe so that folks would have an experience of going through it and then kind of recognizing what it is that we were expecting of them moving forward. And certainly the things that we emphasize in terms of recruiting students into this initiative to be discussion leaders were folks that were open about their experience and beliefs regarding cannabis, open to diverse beliefs, and really capable of being able to maintain the balanced position while navigating a highly polarized topic. Next slide. In terms of the cafe, I think I mentioned a little bit of this, but one of the real goals was to encourage student participation. So that was one of the things that was mainly emphasized. And certainly during the World Cafes itself, employing things like active listening, they were responsible for making sure that every participant within the smaller groups had an opportunity to share their perspective to the questions that were posed to them as part of the World Cafe. And then finally to record the themes that emerged during these discussions so that they could be raised as a full group and reviewed as a collective. Next slide. In terms of the group facilitator, so this would be either myself or Alex Klasan when he was involved in this, and it kind of a variety of different components that the facilitator is responsible for, but ultimately really ensuring that the general structure with respects to trivia is followed. Certainly setting the stage for the World Cafe, outlining the rules, introducing the discussion questions, and then reviewing the final themes, and then the last component, introducing the goal setting and encouraging folks to participate in the evaluation. Next slide. Okay, that's everything for me. So I'll pass the mic on to Jennifer.
Okay, so I'll just give you guys a quick overview of the evaluation of our Cannabis Cafe. So as Jacqueline had mentioned, we facilitated the Cannabis Cafe as part of the course curriculum and delivered it within the classroom. So we made it very clear that the cafe was part of course curriculum and the research was optional and was completed outside of class time. In terms of our evaluation, all students who chose to participate were sent a baseline survey via email after that first classroom visit that Dr. Jacqueline Smith did 1 week prior to the actual cafe. During the cafe, no research data was collected except for counting the number of attendees and the total number of responses to trivia. And then following each Cannabis Cafe, we sent out an immediate follow-up survey to everyone that completed the original baseline. We also had an attendance code as part of it to make sure that people that were completing the surveys were actually in attendance at the cafe. And then we sent out additional follow-up surveys at 1 and 3 months post-cafe. So we had a total of 7 Cannabis Cafes delivered as part of course curriculum to nursing and social work students in the spring and fall semesters of 2019. So as described previously, not all students who attended the cafes chose to participate in the evaluation or the surveys. So at baseline, we had about 311 students complete our survey. And this turned out to be about 70% of the total number of students who attended the cafes. So these are just some of our basic demographics that we found. So majority of participants were female. The mean age was about 23. And actually 60% of participants indicated that they had used cannabis at some point in their lifetime. So a major area of focus for our evaluation was to establish whether the Cannabis Cafe was feasible. So one component of feasibility that we focused on was implementation. So this is to what degree the initiative can be delivered as planned. So some of these questions Joel touched on as well. So one of our first questions, will instructors express interest in this? And we found that yes, absolutely. We had more requests than we could actually handle and presented the cafe to a number of classrooms within the Faculty of Nursing and the Faculty of Social Work. We also asked, will students demonstrate interest in becoming discussion leaders? If so, how many? And how many will actually participate in the cafes? So we had 43 students express interest. And these were recruited from various faculties, including nursing, health sciences, and psychology. We hosted 3 training events to train 31 of these students, and of those trained, 26 were able to attend at least one cafe and participate in the role of a discussion leader. We also wanted to know how many participants will complete the SMART goal setting activity post-Cannabis Cafe. So of the 200 that completed our immediate follow-up survey, 186 completed our SMART goal setting activity. So that's a 93% completion rate for that component. And we also asked how many students from each course will attend the Cannabis Cafe during their scheduled class time. So we had a 55% attendance rate, and this was variable amongst different classes. So we did find that some of our cafes were scheduled to be delivered later in the semester or close to midterms. And we think this definitely impacted our attendance rates. So based on this, we would recommend offering the cafe earlier in the semester. Another component of feasibility that we looked at was acceptability. So this is to what degree participants see the initiative as appropriate. So the majority of our acceptability responses were based off of our immediate follow-up survey. So the 200 participants that responded to that. So just briefly, between 65 and 89% stated they found the various components of the cafe to be interesting, informative, and enjoyable. 66 to 79% stated they found the cafe to be relevant, a good use of time, and they would recommend it to friends. Between 68 and 81% of participants indicated they were more knowledgeable about cannabis and more aware of appropriate and less risky uses due to attending the cafe. Of cannabis users, about half indicated they gained strategies to reduce risk or intended to alter their cannabis practices based on the lower risk guidelines. And of non-users, about half indicated the cafe reinforced their decision to remain abstinent, while 83% indicated they would consider the lower risk guidelines if they did decide to use in the future. So for more detailed information on all of these acceptability questions, please have a look at our facilitator guide or our webinar series where we go into more depth. So in terms of preliminary findings, we had several positive outcomes. So our first significant finding is in the area of descriptive norms. So to measure descriptive norms, we asked participants to estimate how many days within the last 30 days they thought an average University of Calgary student consumed cannabis. And then after providing normative feedback as part of that trivia component of our Cannabis Café, we did find that the average number of estimated days decreased. So there was a significant decrease between the estimates before and immediately after the cafe. There was also a significant difference between pre-cafe 1-month follow-up and pre-cafe and 3-month follow-up. Another significant finding was in the area of external stigma. So we used the social distance scale to explore external stigma amongst participants. We asked them to indicate how willing or unwilling they would be to engage in specific social situations with individuals who use cannabis. And here, higher total scores on this measure indicate more unwillingness or greater stigma. So as we hoped, there was significant decreases in the total scores here. There was a significant decrease between pre-cafe and immediately following the cafe, as well as a significant decrease in stigma when we compared pre-cafe 1-month follow-up, as well as pre-cafe and 3-month follow-up. We also found significant results in the area of internal stigma. So internal stigma was explored among those who reported cannabis use using the substance use stigma mechanism scale. This measure asked students to indicate how they felt about themselves if they engaged in cannabis use. And again, here higher scores indicate higher internal stigma. So there was a significant decrease between pre-cafe and immediate follow-up. And this significant decrease was also maintained between pre-cafe and 1-month follow-up. However, the difference between pre-cafe and 3-month follow-up was not significant. So this indicates that the change may not have maintained at a longer term follow-up. And our final area of significance was looking at the THC and CBD concentrations. So students were asked to identify the THC and CBD concentrations that they would either be most likely to purchase for themselves if they use cannabis, or that they would recommend for someone else if they were not cannabis users. So for this items, students could select from 4 total products. So 2 of these products had higher THC concentrations, and 2 were lower THC and higher CBD products. And here we collapsed the categories into high CBD versus high THC. And we did find a significant statistic here indicating that over time, more students indicated they would either choose or recommend cannabis with lower THC and higher CBD concentrations. So I'll turn it back over to Dr. Jacqueline Smith to talk about our knowledge translation, partnerships, and collaboration.
Thank you so much, Jen, Joel, and Ken for helping to give that background. You can go to the next slide, Jen. So this is the actual product, the Cannabis Café Education and Harm Reduction Initiative Facilitator's Guide. It has gone out to, I think, close to 250 organizations across Canada. And we're just really grateful for those who have expressed interest and have been a part of it as well. The team is there who you've met, except for Joan Smith, my administrative coordinator at the time, who was really helpful with the translation. So we now have the Facilitator's Guide in English and French. We have done, again, protocol paper. We've got the guide. Jen and I did a webinar series that was sent alongside the guide across Canada. And we're now doing presentations as well. I presented at CSAM conference. Joel presented at CCSA as well. So it's getting good knowledge dissemination as well. So next slide, Jen. And again, I want to tell you how much we appreciate the formal endorsement from the Matheson Center for Mental Health Research and Education, as well as that of the CCSA, the Canadian Center for Substance Use and Addiction, who have been very helpful and supportive of this project as well. And next slide. So again, we have multiple collaborators that I just quickly want to acknowledge. Again, the Faculty of Nursing, the UCalgary Campus Mental Health Strategy, specifically Dr. Andrew Zito, the UCalgary Student Wellness Center, like Joel mentioned, Alex Clausen was our harm reduction specialist. Debbie Bruckner was very supportive of this. Center for Addiction and Mental Health. we have Alberta Addiction and Mental Health Research Hub, and the Cannabis Knowledge Exchange Hub as well. So, and we couldn't have done this project without the funding from Health Canada, Calgary Police Service, as well as the Campus Mental Health Strategy, and of course, Faculty of Nursing. So I just want to move right into turning it over to Jen, because we have a brief poll that looks like we have 104 participants today. So we really would appreciate your help here. So go ahead, Jen.
Okay, so I'm just going to share our poll here. So you should have a poll pop up right on your screen. We just have 2 brief questions. If you could take a moment just to answer those, that would be wonderful.
Okay, so as you're finishing that up, we're going to move into our Q&A. So I see 3 questions, which we will address, and then we'll move into the introduction of the panel hosted by Dr. Matt Hill. So Jen, 10:28, so we got a couple minutes, right? We'll let the 28, got about 3 minutes here, 4 minutes to finish that up. Thanks everyone for helping us with this. Again, one of the features of our Health Canada evaluation as well.
Okay, so it looks like most people have voted. So if you haven't, if you could answer those questions for us, but we'll move along into our Q&A panel. So Jacqueline, if you want to take the lead.
Okay, so a couple more questions have come in. So one, and I'm gonna have Joel get our whole panel in here. If Joel and Ken, you want to bring yourself up as well. Question was, did we explore when we were looking at medicinal use, whether the students were using cannabis with a prescription or they were self-medicating? Go ahead, Joel.
Yes, so we did ask them that, and I can't recall the exact percentages, but I do believe that there was a majority of folks who indicated medicinal use, and that it was not prescribed by a physician or healthcare provider.
Right.
But yeah, certainly we did ask that.
Actually, it was about, I could just add one more little nugget, about a third. I'll do it this way. 2/3 said they were not prescribed.
Okay.
So a third said they did get it from a health care practitioner.
Okay. Whoops. Sorry about that. Okay.
Also, we did ask them, did they use it instead of prescribed medication? And about a third also said that they decided to discard using prescribed medication, but use cannabis instead.
Very interesting. Thanks so much, Joel and Ken. One participant asked about the name, wanted us to repeat again the name of the scale that was used for measuring the criteria for cannabis use disorder. And it was CUDIT, so C-U-D-I-T. And I think, Ken, Joel, there's an 8-item and are there 2 different CUDITs? Like, go ahead, Joel.
Yeah, I think there's a revised version, which is the shorter of the 2, which is the one that we had used, and the full name of it is the Cannabis Use Disorder Identification Test revised.
Okay. Wonderful. Okay, so 1028. Oh, good. All right. So here's a question. What was the cost of the entire study, both in Canada and globally? Now I'm a bit confused about the globally perspective, because this was a Canadian study, we did receive a $180,000 grant from Health Canada, and we've been able to use every last penny of that to be able to do it. And I'll just let you know, so we did the pre-legalization, we didn't even speak to, we also did a post-legalization study, and we had a high percent, was it 60%, Joel, of those who did the first, the pre, also participated in the post. Okay, thank you. And we're now in the process of writing up a longitudinal paper to capture that. We also delivered the survey. We partnered with Memorial University in Newfoundland. So they also did a pre-legalization study. I maintained my position as a principal investigator. We just wanted a east-west perspective. So I hope that answered that question. Next question. What were the goals of the research given the enormously low risk of cannabis use versus unsafe drug supply, big pharma opioid sellers, and government sold and promoted alcohol in Canada? So the goals of our research were to, again, to capture the experience pre-legalization of University of Calgary students in relation to cannabis use. And as you saw, 50% had reported, roughly 50, lifetime use, and the other not. We wanted to, like Ken talked about the that second paper about some of the determining features. Ken, do you want to just allude to that a little bit? And just the importance of being able to get that perspective from students. We knew the University of Calgary was working on policies and procedures for cannabis with the legalization. So we just wanted to give a voice to the students who also, by nature of their age, are vulnerable to psychoactive medication. Yes, THC has a psychoactive component. We know that CBD does not, and if it does, a minuscule amount. So we just really wanted to capture this research with, again, with, by nature of the age, a vulnerable group. So I'm going to let Ken say a couple words, and then we're going to move right into the panel so we can be sure you get to get the benefits of speaking to other researchers in the cannabis field. Ken?
Well, I mean, the goals are not ambitious in the sense of, have we figured out what's the long-term risk of cannabis use and how does it compare to harms of other substances, whether they're legal or not? So just trying to get, you know, an early peek of what is the situation of cannabis use among a college sample here in Calgary, and can we learn something about users, whether they're medicinal, whether they're already maybe showing some symptoms of a cannabis use problem, and can that information get fed back to prevention or even treatment efforts?
Okay. Thank you very much, Ken. Okay, we're going to move right into the panel. It's my pleasure to present today two panelists that will be overseen by Dr. Matt Hill. Matt is a basic scientist and professor in the Department of Psychiatry, interested in the role of the endocannabinoid system in the regulation of stress and emotional behavior. The primary focus of his research is to understand the role of the endocannabinoid system and its effects of stress and glucocorticoids. Rebecca Haines-Saah. Rebecca is a health sociologist and an assistant professor in the Department of Community Health Sciences. Her research focuses on adolescent and young adult substance use, harm reduction, and drug policy reform. Since joining the University of Calgary, her research program focuses on youth cannabis use and the public health implications of cannabis legalization in Canada. And last but not least, my good friend, Dr. Monty Ghosh. Dr. Monty Ghosh is an assistant professor and a physician in the opioids dependent program of the Alberta Health Services and the Alex Community Health Center. His research interests include substance use disorders, addiction, harm reduction, substance use recovery, and health inequality. So a reminder, Q&A, please put your questions in Q&A. And Matt, I will turn it over to you to moderate the panel discussion.
Okay. Just to be clear, Jackie, am I going through the Q&A questions that are posted that you guys hadn't got to yet?
You bet, Matt. That would be perfect. Thank you.
Okay, so hi everyone. I'm here to moderate the continuing discussion here with both Dr. Haines-Saah and Dr. Ghosh, providing additional perspectives, and Jackie's already done a good introduction on both of them. So I'm gonna jump over some of these because some of these questions are clearly directed towards Jackie, and maybe Jackie, you and Ken could answer some of them in the box down there regarding specifics about the cafe and the virtual formats of it. Okay, I'm trying to see if any of these questions are kind of broader that would be specific to this panel. Okay, so I'm going to jump over to some of the other ones just in general that have come up as well. So I'll throw this out to both Dr. Haines-Saah and Dr. Ghosh, which is basically some questions on, do you have any advice on how to address harm reduction in a residence environment that has a substance-free policy to it? Okay, Monty or Rebecca?
Sorry, I was mute. I was going to say, Rebecca, do you want to go first, or do you want me to jump in there?
Sure. I'll just say something briefly and then you can follow up. I mean, I think under the banner of legalization, reducing harms is about what are the consequences for young people and how does any penalty for using outside the restrictions by the laws or the institutions impact their futures, right? So we've taken a very harm reduction approach to alcohol on campus around some events that are focused on over drinking and binge drinking, such as Bermuda Short Stay, and we have a post-recovery alcohol support space, you know, and are we using the same approaches to cannabis use? And what are the consequences if people are found using, and how does that impact their stay in residence and their academic careers? So those would be the issues to look at, because if we remove, you know, the legal sanctions, but we just pile on administrative sanctions or other penalties for young people, then we're really missing the mark around. We're just advancing another form of punishment or criminalization would be my sense. So it's difficult to strike that balance.
Yeah, and from my perspective, I have a very clinical perspective on this to reduce cannabis use. So for my clients who don't want to stop necessarily, we discuss concerns with potential problematic cannabis use, looking at their, first of all, we kind of diagnose if they have cannabis use disorder. If they don't, we talk about their overall cannabis use. We talk about linking their cannabis use with medical and social consequences in their life. That is an issue. We talk about their own goals and what they hope to accomplish with their cannabis use, and explore the pros and cons of their cannabis use. Some like basic things that I often tell them to do is like smoke no more than 1 joint per day on weekends, if they can, or just per day in general, and slowly decrease. If they can, just focus just on the weekends, 0.5 to 1 gram a day, no additional joints except in a social situation. If they're younger than 24, and this kind of goes along with your guidelines, we encourage them not to smoke. Other strategies include recording their consumption on a calendar. We do this for all substances, whether it's alcohol or cannabis. Purchase small amounts. Again, it's very similar to alcohol. Wait 10 minutes before inhalation. Wait 20 minutes between joints. And then, again, try to avoid deep inhalations, kind of what you guys have already discussed. Those are my sort of harm reduction strategies that we talk about with patients from a clinical perspective.
Okay, Thanks for that. I'm going to jump to a question that's in the Q&A, but also something that had come up before as well, which kind of relates to some of the stuff Jackie had talked about earlier, especially with the word bubble, which is this idea that a number of the participants in this study, as well as in general in the field, say they use cannabis to treat anxiety. There is definitely some confusion on this, and I think this might be a good opportunity just to get some different perspectives on it. So I'm also happy to chime in here too, since this is very similar to my area, but I'll throw it to you guys first to see what you have to say regarding that question. Do you think that there is levels of cannabis that could be used to treat anxiety? Is it detrimental? Where do you think the evidence stands on this?
Yeah, and I'm interested to see your thoughts or hear your thoughts, Matt, but like from what I've read and understand and looking at my patients themselves, the evidence is kind of, it's not conclusive one way or the other. There was a systematic review that was done, I think it was through the Cochrane review, that basically states that long-term cannabis use can cause increased levels of anxiety. And there's also higher risk of cannabis use disorder secondary to that as well. But short-term use, there might be some effect, but it's debated. And there's also relates to the amount. And like a lot of the studies, they show the drug going two different directions. You can either have poor consequences or beneficial consequences. Or benefits, but it's hard to say. But again, looking at that Cochrane review, I would say I would err on the side of caution, especially when you have active drugs and medications that do treat anxiety and depression. I would venture to say that we should probably do what we have the strongest evidence on, as opposed to things that we don't have stronger evidence on. And then I'll leave it to you, Matt. Sorry.
Rebecca, I'll throw it to you first.
I definitely want to hear from you on this, Matt. This is your area, so thanks.
Yeah, I think I'd say the evidence isn't great, but I think it's extremely important that we do caption that, because this is one of the things that I found really frustrating in the general discussion about health impacts of cannabis and potential therapeutic benefits, and it's no different for anxiety than other stuff. We can look at the reviews like the Cochrane review you talked about, Monty, and other types of evidence that are out there, but the reality is there are no actual clinical trials that have been done properly to date in any capacity regarding cannabis and the treatment of anxiety disorders. And so I think any conclusions are tricky to make at this point at all. I mean, there are well-established harms that can be related to chronic cannabis use that might relate to anxiety. There are also an incredible amount of anecdotes, which are not data in and of themselves either, that also report people who are able to self-medicate and control symptoms. And I would say if you look at the large body of literature overall, it's very difficult to make a position, but I think it's very important that when we talk about there not being evidence to support cannabis as a treatment option for various diseases, be it pain, anxiety, or anything else, that we understand that that's not due to a series of failed clinical trials that have all shown negative outcomes, but is actually due to the fact that there are no legitimate clinical trials that have been properly done to date with cannabis in any of these regards. And so we do just have to be careful about the interpretations, I would say, and how we think of that. Okay, I'll jump back into a question then that might be more specific for this, because this is an interesting one, which is, do you either, Rebecca or Monty, have either of you got any idea about how youth and young adult use of cannabis has changed during the COVID pandemic, either through data you've seen or, Monty, in the context of clinical experience?
Yeah, maybe I'll go first. So anecdotally, I've seen an increase in substance use in general during COVID-19, and I hear a lot of my patients describing difficulties managing their substance use during this pandemic due to factors like social isolation, like a lack of jobs, lack of work, a lack of social structure that they usually have, a lack of supports. So anecdotally, I do hear that there's increase in substance use. So there is some data that suggests there's an increase in alcohol consumption. And there was a paper that was published, I can't remember which journal, that talked about how there is an increase in cannabis use during the pandemic, but this was done during the initial phases of the pandemic, from what I recall. And on top of that, like they reported a 91% increase, which is ridiculous. I can't remember the specifics of whether it was like they had a wide range of age groups, and I don't know what the sub analysis was in regards to youth specifically, but yeah, like anecdotally, yes, it is increasing. There's some data that suggests it's increasing. It'll be worthwhile to see what the data shows now that we're 8 months into the pandemic, and to see if people have sort of normalized their usage or has it actually gotten worse.
Yeah, I would tag on to that. I have a close colleague at UBC who's a youth mental health researcher, and she's been conducting a national survey of substance use and mental health among young people during COVID with the Canadian Mental Health Association BC division, and their preliminary data, not published yet, that she shared last week, is that cannabis use has gone up among people who may be struggling with mental health impacts of isolation and other associated effects of COVID-19, but particularly for groups that are already experiencing marginalization, poverty, trauma, racialization, that use is higher among those groups and among some Indigenous youth. So I think those waves of data are something to watch, but also I think we need nuanced and careful measures to consider how much use is some type of self-medication for boredom and frustration, and not having anywhere to go and what to do. And then also, where does that cross the line into something that's more clinically problematic, as everyone is struggling with the massive changes to our daily lives.
Yeah, I agree. It's definitely a tricky one to figure out, but that's interesting to hear that there's some consensus. I mean, that's generally true from what I've seen as well.
This is Ken. I thought I'd weigh in with a COVID and marijuana vaping research study. Turns out there's a published study already in the literature of young adults, and it looked at smoking and vaping, whether it was cigarettes or not. But as you might expect, because vaping and smoking can damage the lungs, there was a greater proportion of COVID cases among those that were either e-cigarette or e-users versus those that were not. This is in the US, but it's about a 4,000 young adult sample.
Yeah, thanks for that, Ken. Another little bit in there as we get the new data coming out of the pandemic, which is interesting. But actually, that's a good segue from the vaping topic, because this is one of the questions that has come up in advance as well, which is, I'm curious for both Monty and Rebecca, what your thoughts are with respect to vaping. I mean, there is a large harm reduction push that vaping is a safer alternative than smoking. And there has also, but at the same time, been a lot of concern about vaping that has come out of the issues that arose from the States with some of the solvents and additives that have been put in some of the vapes as well. So this might be a good opportunity to have just some perspectives. What do you guys think in terms of vaping as a harm reduction strategy? And is there types of vaping that are potentially less harmful or better to engage in if that's the choice that's being used?
Rick, want to go first, or should I just jump in?
Go ahead, Monty. I'll follow up.
Sure. Thanks. So yeah, like from my perspective, I agree with you, Matt, that there's certain types of vape that might be harmful. It depends on what you vape. So if you're vaping a synthetic, that could be more detrimental versus a natural product. I don't know the literature that well on vaping, but from my perspective, it does, essentially it seems to be doing better. It does reduce your risk of having harmful effects further down the line, such as cancer, for example, is the big concern, lung CA. But I think the data there it's not conclusive. There's just this thought process. We do note that, I think there is some data, I have to double check this, that vaping can reduce cardiovascular disease in comparison to, or has a less risk of causing cardiovascular disease, I should say, in comparison to not vaping and using a joint, a normal joint and smoking it. But yeah, I'm interested to hear your perspectives as well, Rebecca.
I think this is one really great instance of where our public health messaging sometimes is confusing and in conflict for people, especially youth. And again, it speaks to the need to really engage with youth to figure out how they understand the harm reduction messages around vaping versus smoking in ways that really resonate with them. A few years ago in BC, when we started our cannabis youth research with youth, we found that many youth were really, really against mixing tobacco with cannabis because they got the message very strongly from public health that tobacco use was associated, with harms and with potential lung cancer down the road. So they really wanted to make sure that the cannabis they were smoking was pure and not mixed. This was a subset of youth. Other youth really like to mix tobacco and cannabis because of the effects. And I think we're still seeing the same thing with vaping. We see our lower risk cannabis use guidelines saying, the least safe method of consuming is smoking. And so it doesn't advise people to consume other ways. But with the messaging, and some of it is influenced by the vaping industry, that vaping is safer than smoking, it's very confusing and conflicting messaging sometimes for young people to make sense of. So recently there's been a series of Catalyst grants on vaping and a few really good youth engagement projects. So I think we'll learn down the road what messages resonate with young people. But again, it's this place where the evidence isn't clear. And so it's very tricky to communicate risk reduction messages to young people who we know for the most part may do what they're going to do if they're intent on consuming. So very tricky.
Yeah, and I'm curious, just as a follow-up on this, as this is something I've seen go around a bit in pop culture. And there's a little bit of science from what I've seen, but not really behind this. But the idea that even when you look at vaping, that vaping plant matter may be a safer alternative than vaping an oil-based substance that could have additives put into it. And a lot of this seemed to spur from the issues that came out of the States, because the vaping health issues that arose, a lot of them seem to have been, I believe it's ascribed down to like a vitamin E acetate that when combusted created a massive irritant for pulmonary tissue, and that was a lot of what went with it. And so there was this kind of rise that there was concern about things that were being added into vaping solutions. But I don't know, Monty, especially if you've seen any kind of medical data that has looked at any harms associated with this. I've not seen any data that's shown clear harms acutely that have related to plant matter vaping, whereas it's very clear that depending on what is in there, some of the volatile solutions that are used.
You know what? I actually don't know either. And I haven't seen anything in the literature, but I haven't extensively looked either. I would imagine there's no studies done on this and probably some case reports, but that's just me guessing.
Yeah, that's what I would have figured. It's a little fresh. It's hard. Science takes a while to catch up unless it's vaccine development. Then the money goes in.
There's literature. If people want to dig, there is literature on vaping.
On health risks associated with plant matter versus solvents?
Yes.
Yeah, I mean, the only stuff I can think of that I've seen is the original studies that were done on plant matter vaping were the ones that showed that you didn't have byproducts of combustion. So there was no carbon monoxide exhaled. And a lot of that led to some of the original thoughts regarding reduced health risks versus smoking, because you weren't getting some of the stuff that's known to cause lung damage and can be precursors for lung cancer. But I've never actually seen anything comparing solutions to plant matter. So that'll be interesting to look up. Thanks for that, Ken.
Yeah, and I would just want to add before we go away, Matt, that if you look at the Canadian Tobacco Alcohol Drug Use Survey, the most common way of consuming cannabis is still smoking. So many Canadians who are consuming are smoking, and about 22% are still combining with tobacco, right? So there are a lot of opportunities for risk reduction in the way people are consuming. And that is one area of concern, right? How do we reduce the risk? So it can't be an all or nothing conversation. We really have to innovate.
And that tobacco thing is really interesting because all the colleagues I know in addiction psychiatry, so Monty may know this too, they always talk about the increased risk of developing dependency on cannabis when it's mixed with tobacco because of the greater dependency that is just tethered to nicotine in general, and it might amplify some of the effects of cannabis. So that's obviously an additional health risk to come into play. Looking at some of the other questions, I guess a big one that would just be interesting to get from you guys' perspective, both Monty and Rebecca, if there were, and this has popped up in the pre-questions and in the Q&A here, but just in general, if you have young adults who are using cannabis at a relatively higher rate, and they actually would like to reduce their use rates, do you have recommendations? I mean, I know Jackie had kind of gone through the low risk cannabis use guidelines, and they're obviously very good template. I mean, Rebecca, I know you've talked about those a lot too for everyone, but if you guys were having kind of a one-on-one with a younger person who actually wanted to ask advice on suggestions for harm reduction and reducing use, what would you guys suggest?
Oh yeah, okay. I thought I covered this, but more or less the same things that I kind of mentioned before. So engage with them, see what their concerns are, where they want to be. Talk about trying to reduce and keep count of how many joints they're smoking, grams, and weighing out their consumption. Using a calendar to keep track, and see where they're at, because I find a lot of times patients, they don't know how much they're actually smoking. They assume one thing, but then in fact it's something completely different. Take breaks in between joints, take breaks between inhaling. So waiting 10 minutes to 20 minutes per inhalation. Those would be my main things with harm reduction. I mean,
and in your experience, have you found that people respond to them?
I think so, yeah. And I would say so. The other thing that we sometimes use is pharmacotherapy for harm reduction purposes. So there's some evidence to suggest that gabapentin is actually effective for treating cannabis use disorder, and decreasing cravings for cannabis. Study's not very strong. It's not a very strong study, and I mean, we sometimes do it as a Hail Mary because we have nothing else out there from a pharmacotherapy perspective.
Have you ever tried Nabilone? I mean, I know it's kind of a substitution approach, but I've heard more often, I mean, I would be surprised actually have you received any blowback from people about going on to a pharmaceutical like gabapentin as a treatment strategy to get off of cannabis? I would assume there'd be a fair amount of people who would be uncomfortable with that actually.
100%. And actually the substitution studies have demonstrated there's actually a reduction in overall cannabis use, but no cessation per se.
Yeah. I've never seen anything that's actually shown cessation.
Mm-hmm.
But okay, curious, Rebecca?
Yeah, I mean, when we talk to teens, one of the things we also talk about that I think we can't dismiss when we're talking about young adult use or campus use is the context of use, right? So are you using cannabis in a relationship with a partner? Is that an activity you're engaging in? Is something really prevalent in your friend group? Or using it on your own as a way to relax or, self-medicating. So thinking about the context of use and what's wrapping around that. A lot of times individual patterns are based to things we're experiencing that are structural, right? And for young people too, with consuming substances like alcohol and cannabis and being potentially intoxicated, there's risks in other areas like driving, or maybe consumption in the workplace. So I think a real harm reduction approach, because no one's mentioned, I'll just remind people, is meeting people where they're at, right? Finding out how cannabis use is embedded in their daily lives and relationships in their community, and figuring out what areas might be problematic, what areas might be beneficial, and what the person using wants to do right now to reduce their risks. And those type of conversations make people feel validated. They make them feel empowered. And, they keep them attached to you as a trusted clinician or a trusted, friend, advisor, that you're going to accept them and support them wherever they're at in their stage of use. So that would be my add-on.
Yeah, I think that's an incredibly important point to consider in all of this is context for sure. Okay, we're coming down to the very end. So I'm just looking to see if there's any more questions popping up. I guess this is something I'm actually curious, Rebecca, maybe you could provide some information on, because I feel like you know it better than any of us. But one of the questions actually is asking, are there any longitudinal studies following cannabis users in Canada right now? I mean, in the context of youth, for those of you who are unaware, the United States is doing a very large scale study called the ABCD study, of which cannabis is a small component, but it's basically tracking about 10,000 kids from 10 to 20, looking at baseline variables of biology and neuropsychological functioning, and then tracking them across development with multiple outcome measures being tracked. And one of the big questions they want to see is what happens with the onset of cannabis use, with brain development, with academic performance and neuropsychological functioning. So, I mean, I know it's been slowed down a little bit with COVID, obviously, but that is pretty well underway. I think this is year 4 or 5 they're at right now. So I know there will be some very interesting data to come out of that. But in the context of Canada, Rebecca, are you aware of large-scale data studies that are going on with cannabis users, especially adolescents?
I think there was a lot of talk pre-legalization about replicating the ABCD study in Canada. To my knowledge, I haven't heard that we're doing something similar. I know that there's been a few more time-limited cohort studies in the Maritimes, and also in Victoria, I think, by investigators there. So I think we have regional studies. I'm not aware of a national study, but that's a cohort like that, but I could be wrong. I know that some of the Alberta cohort studies that are following families, they are starting to ask and embed more questions about cannabis use. So I think if something isn't focused on cannabis, more people are now aware that it's a growing area and trying to embed it in the data they're collecting. But yeah, it's a real need.
Yeah, that's what I thought. It's pretty much what I thought. So good to reinforce that. So that's the end of the panel now. So I'd like to give a big thanks to Dr. Ghosh and Dr. Haines-Saah for participating and contributing feedback on all this stuff. And I will sign out myself and pass things back to Jackie to wrap up. So thanks a lot, everyone.
Thanks very much, Dr. Hill, and Dr. Ghosh and Dr. Haines-Saah as well too. Really appreciate your expert opinions, and Rebecca, I do love that you ended with, you know, the fact that we do need to meet people where they're at, as a place of validating and empowerment, and that whole motivational interviewing approach. So this has been an incredible morning. I don't think I would. I'm just really happy with how it's gone. I want to thank you all for participating, for being interested in this really important topic. I know we didn't get to all the questions in relation to the Cannabis Cafe Facilitators Guide. So please feel free to email myself or my research team, and we would be very happy to address those. So again, we're in the midst of a global pandemic. Please take care of yourselves, be well, and let's stay in touch, because it's together we can get through these struggles and support of one another. So thank you all, and have a great day.